What is albiglutide? And what is albiglutide injection used for? Albiglutide injection is used with a diet and exercise program to control blood sugar levels in adults with type 2 diabetes, condition in which the body does not use insulin normally and therefore cannot control the amount of sugar in the blood, when other medications did not control levels well enough. Albiglutide injection is not used to treat type 1 diabetes, condition in which the body does not produce insulin and therefore cannot control the amount of sugar in the blood, or diabetic ketoacidosis, a serious condition that may develop if high blood sugar is not treated. Albiglutide injection is in a class of medications called incretin mimetics. It works by helping the pancreas to release the right amount of insulin when blood sugar levels are high. Insulin helps move sugar from the blood into other body tissues where it is used for energy. Albiglutide injection also works by slowing the movement of food through the stomach. Over time, people who have diabetes and high blood sugar can develop serious or life-threatening complications, including heart disease, stroke, kidney problems, nerve damage, and eye problems. Using medications, making lifestyle changes, e.g., diet, exercise, quitting smoking, and regularly checking your blood sugar may help to manage your diabetes and improve your health. This therapy may also decrease your chances of having a heart attack, stroke, or other diabetes-related complications such as kidney failure, nerve damage, numb, cold legs or feet, decreased sexual ability in men and women, eye problems, including changes or a loss of vision, or gum disease. Your doctor and other healthcare providers will talk to you about the best way to manage your diabetes. How to use albiglutide injection. Albiglutide injection comes as a powder to be mixed with water in a pre-filled dosing pen to inject subcutaneously, under the skin. It is usually injected once a week without regard to meals. Use albiglutide injection on the same day each week at any time of day. You may change the day of the week that you use albiglutide as long as it has been 4 or more days since you used your last dose. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Use albiglutide injection exactly as directed. Do not use more or less of it or use it more often than prescribed by your doctor. Albiglutide injection controls diabetes but does not cure it. Continue to use albiglutide injection even if you feel well. Do not stop using albiglutide injection without talking to your doctor. Albiglutide comes in pre-filled dosing pens that contain enough medication for 1 dose. Always inject albiglutide in its own pre-filled dosing pen, never mix it with any other medication. Carefully read the manufacturer's instructions for use that come with the medication. These instructions describe how to prepare and inject a dose of albiglutide injection. Be sure to ask your pharmacist or doctor if you have any questions about how to prepare or inject this medication. Always look at your albiglutide before you inject it. It should be clear, yellow, and free of solid particles. You can inject your albiglutide in your upper arm, thigh, or stomach area. Never inject albiglutide into a vein or muscle. Rotate the injection site within the chosen area with each dose. You can inject albiglutide and insulin in the same body area, but you should not give the injections right next to each other. Never reuse or share needles or pens. Always use a new needle for each injection. Dispose of needles in a puncture-resistant container. Ask your doctor or pharmacist how to dispose of the puncture-resistant container. When to use albiglutide injection. Before using albiglutide injection, tell your doctor and pharmacist if you are allergic to albiglutide, any other medications, or any of the ingredients in albiglutide injection. Tell your doctor and pharmacist what other prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking or plan to take. It is especially important to tell your doctor about all the medications you take by mouth because albiglutide may change the way your body absorbs these medications. Also be sure to mention insulin or oral medications for diabetes, especially sulfonylureas, including chlorpropamide, diabetes, glimepiride, amaryl, inavandril, indutact, glipizide, glucotrol, glyburide, diabeta, glinase, inglucovins, ralizumide, and tolbutamide. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor if you have or have ever had pancreatitis, inflammation of the pancreas, severe stomach problems, including gastroparesis, slowed movement of food from the stomach to the small intestine, or problems digesting food, or kidney or liver disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while using albiglutide injection, call your doctor. Ask your doctor what to do if you get sick, develop an infection or fever, or experience unusual stress. These conditions can affect your blood sugar and the amount of albiglutide you may need. What special dietary instructions should I follow? Be sure to follow all exercise and dietary recommendations made by your doctor or dietitian. What should I do if I forget a dose? Use the missed dose as soon as you remember it. However, if it is more than 3 days after the missed dose, skip the missed dose and continue your regular dosing schedule. Do not use a double dose to make up for a missed one. What side effects can albiglutide injection cause? This medication may cause changes in your blood sugar. You should know the symptoms of low and high blood sugar and what to do if you have these symptoms. Albiglutide injection may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Diarrhea, nausea, heartburn, redness, swelling, or itching at the site of the injection, cough or flu-like symptoms. Some side effects can be serious. If you experience any of these symptoms, stop using albiglutide injection and call your doctor immediately or get emergency medical treatment. Ongoing pain that begins in the upper left or middle of the stomach but may spread to the back. Vomiting, hives, rash, itching, difficulty breathing. Albiglutide injection may cause other side effects. Call your doctor if you have any unusual problems while using this medication.